Good afternoon. My name is Dr. James Wade. I'm a thoracic surgeon. I'm here today to talk to you about robotic thoracic surgery. We're coming to you live from the operating room at Central DuPage Hospital. I wanted to introduce you to our surgical robot here and talk about some of the details of the surgeries that we have to offer and take any questions that you may have later in the talk. So this is the surgical robot called the DaVinci Xi machine by Intuitive. And as you can see, there are 4 arms as part of the robot through which we can insert a variety of instruments and a camera. With these instruments, we can make small incisions to gain access to the body to do many types of chest surgeries, including surgeries for cancers, to make small incisions to remove these tumors, accomplishing the same surgery that 20, 30 years ago we used to have to do through a large incision. The main advantage of the surgical robot is making those small incisions. That allows for less pain, faster recovery, shorter stay in the hospital, and a quicker return to life as normal, your home, your family, and putting what could be a scary situation, a scary time in your life behind you and getting back on with normal life. Robotic surgery first came on the market about 2 decades ago, and there's been lightning fast advances over that time. This is actually the 5th generation of this machine, and with each iteration we've made advances in terms of what we're able to do inside of the body. A machine like this allows us access to small, difficult to reach, tight areas anatomically that before we used to have to make large incisions to gain access to. And again, minimizing that incision really gets your bang for your buck in terms of getting you better faster and out of the hospital. We're still able to do an oncologically excellent operation, remove the tumor, remove the lymph nodes, and get you that same benefit of being cancer-free, but with faster recovery times. Some would say that those smaller incisions allow for less chance of bleeding, less chance for complications, all of which contributes to you getting better faster. What else can I tell you today? My main types of surgery that I perform, being a thoracic surgeon, are on the lung and on the esophagus. Other areas in the chest include the front of the chest or the thymus. But I offer a wide array of surgeries that I can use the surgical robot to accomplish. Lung cancers, traditionally, 20, 30 years ago, used to have to be performed through a large incision that would involve spreading the ribs, sometimes even breaking the ribs, in order to take the tumor out and make you cancer-free. With this technology, 4 arms, 4 small incisions to gain access inside of the chest, inside of the thorax, operating on the lung, some of the largest blood vessels in the body, and do it safely, effectively to remove the tumor and make you cancer-free. The same goes for the esophagus. The tube that connects our mouth to our stomach runs all the way in the back of the chest, behind lots of important anatomy around the heart, the aorta, the spine. This machine allows us to gain access to that area that heretofore would have required a large incision, sometimes a large incision in the abdomen and a large incision on the chest to get access to the tumor, to the organ, to be able to remove it safely. Minimally invasive surgery has navigated around all of those quandaries to still accomplish the same operation, but with smaller cuts, less pain, faster recovery. patients really notice the difference after an operation such as this to be able to be up and mobile faster, up and walking, and then get home back to their family sooner than before was possible. We have any questions coming in? What else can I tell you about robotic thoracic surgery?
So Dr. Wade, with the practice, your thoracic practice, are there surgeries that you would not do with the da Vinci?
Certain tumors are not amenable to be removed with this technique, and we still need to rely on traditional what we call open surgery. But this technology has really allowed us to push the envelope in terms of what is possible. We are able to take out larger and larger tumors that are more complex as the technology gets better and our surgical skill continues to evolve on the backs of machines like this. But certain surgery still requires the open approach. But you should always ask your doctor, your surgeon, your oncologist what surgery is right for you.
Do you want to touch on the question if robotic surgery is covered by insurances?
Yep. So robotic surgery should be covered under all insurance. There's no exception as far as the method in which we perform your operation. It's usually a surgeon preference how that would be done, whether through an open approach or a large incision, through a minimally invasive approach, which can either be what's called straight stick or VAC surgery versus robotic surgery. Should be no difference in coverage.
And then, what do you see on the horizon for robotic surgery? So you mentioned this has been around for 2 decades. What do you see in the coming years?
So the technology continues to evolve, and it's both information-driven and surgeon-driven. The things that we learn with each new operation helps us talk to the engineers and does help even have a hand in designing the next generations of these machines. Things like being able to see actually into and through the tissue to visualize a tumor or to visualize important structures like blood vessels and airways. Some forms of that are available to us now, but pairing that technology with 3D imaging, like overlapping our CAT scans into our visual field of the robotic console, is on the horizon, and I think will be coming in the years to come.
So a question did come in. A viewer wrote they have EOE and have had 18 surgeries with biopsies over the last 5 years. They're concerned with this many invasive procedures and biopsies. Is there potential for the esophageal cancer to occur from all of this?
So biopsies in and of themselves will not, I think the viewer is referring to eosinophilic esophagitis, if I am understanding their abbreviation correctly. Biopsies by themselves will not increase the risk of cancer. The traditional risks for increase of esophageal cancer, depending on the histology, are things like smoking, sometimes alcohol consumption, or even excessive gastroesophageal reflux. That does not mean that just those risk factors will result in a cancer, but they can increase the risk.
Thank you for answering that. Can you talk about the surgical team and if that has changed at all going to having a minimally invasive surgery compared to what it was traditionally 20 years ago?
Mm-hmm. So we have an entire robotics team here at Central DuPage Hospital. Each team member is trained to manage the surgical robot, And that would include the surgeon, first and foremost, as well as surgical assistants, surgical scrub technicians, our anesthesia team, and then our circulating nurse. They all know the ins and outs of what it is to make this room work and run smoothly and efficiently. But it is a different training than it was 20 years ago. We all still know how to do the traditional surgery, but this is another level of technology that we're able to offer.
And in general, Dr. Wade, can you talk about success rates of robotic surgery versus traditional?
So the success is largely the same. The goal, of course, is to remove the tumor and make you cancer-free. But the way in which we do it, we think of surgery as sort of a very controlled trauma. Incisions and cutting tissue is an insult to the system, and how much of that we have to do dictates how well you recover. And if we can minimize that trauma, minimize those incisions, push the envelope to be truly minimally invasive surgeons, recovery follows that suit, and folks can have very speedy recoveries, have much less pain, much less need for pain medication, and get back to their normal lives, back to their homes and families much faster. For an open operation that I would have done 10, 15 years ago, you might be in the hospital a week and a half. With certain surgeries offered with the robot, you could go home as early as the same day, taking minimal amounts of pain medications and getting back to life as you knew it before.
So can you talk a little bit about the transition from doing a traditional surgery to using the robotics? And I can imagine it had to be challenging from using your hands to actually operate and converting that into using the robot to assist you.
So we all go into surgery with a little bit of, I guess you would say, hand-eye coordination. We want to translate that into caring for people's health care and their overall benefit and lives. And each method of surgery lends a little bit of that skill set. Open operations, we are using our hands directly on the instruments, directly on the patient, directly on the organs. This is just one step translated from that. The thing that makes this technology so astounding, you might see written on the machine here the word intuitive, is that the technology is exactly that. Just how I would move my hands to accomplish any one step or move in an operation. These instruments can duplicate that motion. And you can see the difference between my hands and the size of these instruments, what that would translate to in terms of the size of the incision that I might need to make to get into a surgical field. I can do the same motions with an instrument 8 millimeters in diameter through a small incision, delicately getting around a major blood vessel, delicately removing a portion of the lung that has a tumor in it and its surrounding lymph nodes, to accomplish the same goal of making the patient cancer-free, but with a fraction of the size of the incision.
And so with all the different arms that are there, are you typically utilizing all four of them or 2 out of 4 at a time? Can you talk a little bit about that?
This is where the technology has again taken us another step down the road. In training, we would always be taught you're a two-handed surgeon. You want to be using all 10 digits, both hands, to accomplish your goal. Here, you're a four-handed surgeon. All of these arms are under my control during the operation the entire time. I can direct my camera to visualize the surgical field to look exactly where I need to look in the operation. I can retract tissue to hold it under the exact right tension, get the exact right exposure that I need. And then with my 2 main operating hands, come around blood vessels, be able to divide airways, divide lung tissue, to be able to accomplish that goal of removing the tumor or whatever specific operation that we're there for that day. So you really become a multifaceted surgeon, very self-reliant, to be able to do complex surgery inside of a tiny space through tiny incisions.
So you talked a little bit about how your hands translate to the robot. How about the visual aspect of it?
Sure. So minimally invasive surgery was a field that was born about 30, 40 years ago, where we first thought of the benefit of, instead of making large incisions, maybe we can get cameras inside of the body to make small incisions. And those first surgeries transpired in the 80s and 90s, and then this technology was born from that. Some of the problems or aspects of those initial generations of surgery was the two-dimensional vision through a traditional telescope. A light source and a lens will translate an image from wherever that camera is going to a video screen. But depth perception, the three dimensions that we can see with our own eyes, was one thing that was lacking from those early generations of cameras. The robotic camera actually mimics or recreates that three-dimensional vision. There are two eyes to the camera, just as we see with two eyes, to make your vision three-dimensional. I can tell the exact depth within my field of operation, exactly how far structures are in the foreground or the background, which just lends itself to safer, more controlled, more precise surgery exactly where we need it in small spaces with some of the major blood vessels.
And then a robotic surgery versus traditional, what's the length of time in comparison?
The length of the surgery can be somewhat similar. As surgeons become more adept at robotic surgery or minimally invasive surgery, it might take just as long between a traditional open incision case versus a minimally invasive incision case. But the true benefit we find translated after the surgery itself. Remember, the main goal is to make someone cancer-free or remove the problem area through surgical technique. But how are you going to recover after that surgery? How much pain are you going to have? What's the size of your incision? All of those factors will combine together to get you that result.
And then, Dr. Wade, can you show us maybe up close a little bit and talk about the end of one of these?
Sure.
Arms that assist you in surgery?
So can you see that? Is that within the field of view? So one of the differences for the robotic surgical instruments is that we have degrees of motion both roticulating here or rotating that we would find with traditional minimally invasive surgery, and then the usual sort of straight stick degree of motion to manipulate tissue inside of the body. But the true advancement is this so-called wristed technology, where the instrument is able to bend, mimicking a wrist in all three dimensions in space inside of the patient, just as the same motion as my hands would. Just as I would perform surgery open with my hands and fingertips and wrist joints, the instrument can match that with a fraction of the size.
Thank you. A viewer wrote in, is there a future for robotic surgery during mastectomy to remove multiple breast tumors that haven't been impacted by chemo and radiation?
So some surgeons are performing some breast surgeries with the surgical robot. I would say it's not the majority of cases the way that surgery is performed, but again, that would be a question for your breast surgeon. What is their preference in terms of method for surgery? Again, just having the robot doesn't necessarily translate to better, but if we're able to make those smaller incisions and count on less pain and faster recovery, the patients really feel that benefit in the after effect.
That's all the questions we have. Thank you so much for allowing us to come into the OR with you today.
Thank you very much for your time and tuning in.